Hi, I'm Dr. Jennifer Carlisle, Assistant Professor of Hematology and Medical Oncology at the Winship Cancer Institute of Emory University. Now let's focus on the safety of HER2-targeted antibody-drug conjugates in non-small cell lung cancer. I want to focus first on practical considerations for managing HER2 antibody-drug conjugates based on their mode of action. First, the antibody-drug conjugate binds to the HER2 receptor, and then this complex is internalized by endocytosis, and the cytotoxic effect is induced by drug payload release. We can see bystander killing effect from a variety of mechanisms, including release of the drug payload from the antibody after antigen binding and before internalization, or release of the drug payload from the intracellular space if there is high drug membrane permeability. And it's important to note that drug payload release after linker cleavage helps patients get good anti-tumoral efficacy despite low HER2 antigen density when drugs have a high drug to antibody ratio. So while these bystander killing effects may lead to cytotoxic toxicities that we attribute to the payload, they're also very important for their anti-tumoral effects, especially in patients that lose HER2 expression or with cells that develop lower HER2 protein expression. Careful attention should be given to lab parameters for dose delay and dose reduction as needed. First is the safety of adotrastuzumab emtansine based on the basket trial study. Here you can see in this small study, a number of patients had elevated AST, ALT, thrombocytopenia, and fatigue and nausea, but these were low at grade 1. There were a few patients with infusion reactions or weight loss seen at grade 2, and only one patient with grade 3 anemia. Of note, the FDA package insert has warnings for adotrastuzumab emtansine for the breast cancer indication, listing hepatotoxicity, liver failure, and death that have occurred, with the need to monitor hepatic function prior to initiation and prior to each dose. Physicians should also be mindful that this may lead to reductions in left ventricular ejection fraction. Moving on to the safety of trastuzumab deruxtecan in non-small cell lung cancer, here in the DESTINY-Lung01 cohort of HER2 mutated non-small cell lung cancer, treatment emergent adverse events listed here in greater than 15% of patients. We can see a high number of patients with nausea, alopecia, anemia, decreased appetite, and neutropenia. And grade 3 AEs that were more common were nausea, anemia, and neutropenia. Summary data here of the 42 patients thus far reported showed all had at least one treatment emergent adverse event, and these patients had a median treatment duration of 7 months. 52% had grade 3 or higher drug-related AEs, but only 17% had drug-related serious treatment-related AEs. The most common AEs associated with dose reduction were fatigue and nausea, whereas the most common AEs associated with dose interruption were neutropenia or lung infection. There were 5 patients who had death on the trial, but none were related to the treatment. One adverse event of special interest is interstitial lung disease. Here you can see of the 42 patients thus far reported, only 5 had ILD, all were grade 2. The median time to onset was around 86 days. 4 patients stopped treatment and 1 had drug interruption. All received steroid treatment, and most are recovering at the time of data cutoff. Fortunately, no grade 5 ILD was observed in this cohort. So in summary, antibody-drug conjugates show reasonable safety and characteristic cytotoxic related side effects that can be managed.